Question 1. A sterile processing technician is preparing to clean a low-risk patient transport cart. They select a quaternary ammonium compound, QUAT, for the task. Before applying the QUAT, they notice the cart is heavily soiled and consider washing it with a standard anionic soap. Why should the technician avoid mixing or using these two chemicals together? A. The mixture creates a highly toxic and flammable gas. B. The soap's negative charge neutralizes the QUAT's positive charge, rendering it ineffective. C. The soap aggressively accelerates the evaporation rate of the QUAT. D. The combination forms a corrosive acid that damages stainless steel. Correct answer B. Knowledge point explanation. Core rationale: quaternary ammonium compounds are cationic, positively charged, low-level disinfectants. Standard soaps and detergents are typically anionic, negatively charged. When these two come into contact, they chemically neutralize each other, completely destroying the QUAT's ability to disinfect the surface. Trap analysis: option A is incorrect because mixing bleach, a halogen, and ammonia creates toxic gas, not soap and QUATs. Option C is incorrect because QUATs do not have a rapid evaporation problem, that is a characteristic of alcohol. Option D is incorrect because QUATs and soap do not form a metal-eating acid. The primary danger is simply the deactivation of the germicidal properties. Concept extension: in addition to soap, QUATs are also notoriously susceptible to cotton depletion, where natural fibers absorb the active ingredient, which is why synthetic wipes must be used. Question 2. A technician is assigned to manually disinfect a batch of heat-sensitive semi-critical devices using a basin of activated glutaraldehyde. To comply with strict Occupational Safety and Health Administration (OSHA) safety protocols, which specific type of personal protective equipment, PPE, must the technician wear on their hands to prevent chemical absorption? A. Standard latex examination gloves. B. Heavy-duty cotton decontamination gloves. C. Nitrile or butyl rubber gloves. D. Heat-resistant silicone gloves. Correct answer C. Knowledge point explanation. Core rationale: glutaraldehyde is a highly toxic high-level disinfectant, HLD, that can readily permeate certain materials. Nitrile and butyl rubber gloves are explicitly required because they provide an effective chemical barrier, preventing the toxic solution from absorbing through the glove and causing severe contact dermatitis or systemic absorption. Trap analysis: option A is incorrect because latex is highly permeable to glutaraldehyde. The chemical will pass through the latex and burn the skin. Option B is incorrect because cotton provides zero fluid barrier and would instantly soak up the toxic chemical against the skin. Option D is incorrect because silicone gloves are used for thermal protection, like unloading a sterilizer cart, not for chemical resistance in a wet basin. Concept extension: beyond specialized gloves, processing with glutaraldehyde strictly requires a well-ventilated room with a minimum of 10 air exchanges per hour to mitigate respiratory hazards from the fumes. Question 3. After a flexible bronchoscope completes its required immersion time in a high-level disinfectant, HLD, and undergoes a thorough final rinse with sterile water, the technician moves to the drying phase. According to industry guidelines, what is the approved method for drying the external surfaces and internal channels of this semi-critical device? A. Wiping with lint-free towels and allowing it to air dry passively. B. Purging and drying with high-efficiency particulate air, HEPA, filtered air. C. Baking the device in a low-temperature drying cabinet at 140 degrees Fahrenheit. D. Flushing the channels exclusively with an iodine-based antiseptic. Correct answer B. Knowledge point explanation. Core rationale: after achieving HLD and rinsing with pure/sterile water, the device must not be recontaminated by airborne microbes. Forced, pressurized air must be passed through a HEPA filter to ensure that the air blowing out the internal lumens and drying the external surfaces is completely free of environmental contaminants. Trap analysis. Option A is incorrect because passive air drying exposes the moist scope to airborne dust and microbes, risking recontamination. Option C is incorrect because baking a flexible endoscope at 140 degrees Fahrenheit can easily melt or damage the delicate internal optics and adhesives. Option D is incorrect because iodine is an antiseptic for patient skin, not a drying agent for instruments. 70% isopropyl alcohol is typically used for the final drying flush, not iodine. Concept extension. The drying process is critical. Any residual moisture left inside a lumen during storage creates a breeding ground for biofilm formation and bacterial proliferation. Question 4. When utilizing a mechanical washer disinfector to process surgical instruments in the decontamination area, what is the primary mechanism responsible for achieving the thermal disinfection of the items during the final cycle? A. The prolonged injection of saturated steam under pressure. B. The antimicrobial properties of the enzymatic detergent. C. The specific temperature of the highly heated water. D. The chemical action of liquid hydrogen peroxide. Correct answer C. Knowledge point explanation. Core rationale. Thermal disinfection relies entirely on kinetic heat to destroy vegetative microorganisms. In a washer disinfector, this is accomplished during the final rinse phase by exposing the instruments to specifically calibrated high-temperature water, often reaching 194 degrees Fahrenheit or 90 degrees Celsius, for a predetermined amount of time. Trap analysis. Option A is incorrect because pressurized steam is the mechanism for an autoclave, sterilization, not a washer disinfector. Option B is incorrect because enzymatic detergents are formulated to break down bioburden, blood, fat, protein, for cleaning, not for killing microbes. Option D is incorrect because hydrogen peroxide is a chemical sterilant used in low-temperature gas plasma sterilizers, not in a standard thermal washer. Concept extension. While thermal disinfection successfully kills pathogens and makes instruments safe to handle for the prep and pack staff, it does not kill bacterial spores, meaning critical instruments still require terminal sterilization afterward. Question 5. A high-volume endoscopy clinic utilizes automated endoscope reprocessors, AERs, that reuse a high-level disinfectant, HLD, reservoir. Throughout a busy 12-hour shift, multiple gastroscopes are processed sequentially in the same machine. To ensure patient safety and chemical efficacy, when must the technician verify the minimum effective concentration, MEC, of the HLD solution? A. Prior to the start of each new shift. B. Before every single processing cycle. C. Only when the machine's warning sensor activates. D. Once daily during the morning equipment testing. Correct answer B. Knowledge point explanation. Core rationale. Reusable HLD solutions are constantly diluted by the tiny amounts of rinse water carried in on wet endoscopes, and the active chemicals degrade over time. Therefore, to absolutely guarantee the solution is strong enough to kill pathogens, a chemical indicator test strip must be used to check the MEC immediately before every single use or cycle. Trap analysis. Options A and D are incorrect because testing once per shift or once per day is grossly inadequate. The chemical could fall below the effective concentration after just 2 or 3 scopes, leaving subsequent patients exposed to undisinfected devices. Option C is incorrect because AERs do not have internal chemical sensors that test the MEC. It is a manual, technician-driven process requiring a physical test strip. Concept extension. The results of this MEC test must be explicitly documented in the facility's logbook for that specific scope and cycle, ensuring full legal traceability if an infection control breach occurs. Question 6. A sterile processing technician uses a machine that utilizes water at 194 degrees Fahrenheit to destroy nearly all pathogenic microorganisms on a tray of surgical instruments, although this method leaves bacterial spores intact. What is the specific term for this process? A. Sterilization. B. Thermal disinfection. C. High-level chemical disinfection. D. Mechanical cavitation. Correct answer B. Knowledge point explanation. Core rationale. Thermal disinfection is a method that utilizes intensely heated water to achieve a high-level kill of vegetative bacteria, but it fundamentally lacks the capability to destroy bacterial spores. Trap analysis. Option A is incorrect because sterilization guarantees the total eradication of spores. Option C is incorrect because this scenario specifically describes the use of water temperature, heat, not a liquid chemical agent. Option D is incorrect because mechanical cavitation refers to the imploding bubbles created by ultrasonic cleaners to remove physical soil, not the thermal destruction of microbes. Concept extension. Mechanical washer disinfectors routinely employ this thermal method during their final rinse cycle to make instruments safe for staff to handle during the subsequent inspection and packaging phase. Question 7. Before a surgeon makes an initial 4-inch abdominal incision, the operating room staff applies a specific iodine-based chemical directly to the patient's living skin tissue to halt and slow the replication of localized microorganisms. What is the correct classification for this chemical agent? A. Halogen surface disinfectant. B. Glutaraldehyde solution. C. Antiseptic. D. Enzymatic bacteriostatic. Correct answer C. Knowledge point explanation. Core rationale. Antiseptics are specialized antimicrobial chemicals formulated explicitly to be safe for application on living tissue, animate objects, to inhibit or eliminate resident flora prior to surgical procedures. Trap analysis. Option A is incorrect because surface disinfectants are highly toxic and strictly designed for inanimate objects, not human skin. Option B is incorrect because glutaraldehyde is a severely irritating high-level disinfectant, HLD, that would cause immediate tissue damage. Option D is incorrect because enzymatic solutions are designed to break down biological proteins and fats on dirty instruments, not to control bacteria on a patient's abdomen. Concept extension. While some antiseptics only inhibit bacterial growth, bacteriostatic, most common surgical preps, like iodine and 70% isopropyl alcohol, are actually bactericidal and actively kill the microbes. Question 8. An orthopedic surgeon requests a specialized titanium bone drill bit for a procedure. Because this device will physically penetrate normally sterile bodily tissue and enter the patient's vascular system, what classification does it fall under according to the Spalding system? A. Semi-critical item. B. Non-critical item. C. Critical item. D. High-level procedural item. Correct answer C. Knowledge point explanation. Core rationale. Under the universally recognized Spalding classification system, any medical device that directly enters sterile tissue or the vascular, bloodstream, system is deemed a critical item. Due to the extreme risk of severe infection, these items absolutely mandate terminal sterilization. Trap analysis. Option A is incorrect because semi-critical items only come into contact with mucous membranes or non-intact skin, e.g., endoscopes, and require at least high-level disinfection. Option B is incorrect because non-critical items only touch intact skin, e.g., blood pressure cuffs, and require low-level disinfection. Option D is incorrect because it is a fabricated distractor that does not exist within the Spalding framework. Concept extension. Other common examples of critical items include surgical forceps, cardiac catheters, hypodermic needles, and permanent metallic implants. Question 9. Which of the following processing categories is defined exclusively by its uncompromising ability to completely obliterate and eradicate all recognized forms of microbial life, inherently including massive populations of highly resistant bacterial spores? A. Thermal disinfection. B. Sterilization. C. Intermediate level disinfection, ILD. D. High level disinfection, HLD. Correct answer B. Knowledge point explanation. Core rationale. sterilization represents the absolute highest standard of microbial destruction in the sterile processing department, SPD. The definitive and measurable boundary that separates sterilization from any level of disinfection is its guaranteed capability to destroy highly resilient bacterial spores. Trap analysis. Option A is incorrect because thermal disinfection uses hot water to kill pathogens but fails to destroy bacterial spores. Option C is incorrect because ILD only targets vegetative bacteria, mycobacteria, and some fungi, leaving spores completely unaffected. Option D is incorrect because while HLD eradicates all vegetative microbes and viruses, it cannot reliably kill large concentrations of bacterial spores. Concept extension. Because the destruction of spores is the ultimate test of sterilization, facilities use specialized biological indicators containing millions of live Geobacillus stereothermophilus spores to verify the effectiveness of steam sterilizers. Question 10. Iodophores, which are commonly utilized in healthcare settings as both environmental surface cleaners and specially formulated patient skin preparation solutions, belong to which distinct chemical family? A. Phenolics. B. Quaternary ammonium compounds, quats. C. Halogens. D. Alcohols. Correct answer C. Knowledge point explanation. Core rationale. The halogen chemical family comprises highly reactive elements, most notably iodine, chlorine, and fluorine. Iodophores are specific chemical complexes that utilize iodine as their primary active ingredient to achieve powerful antimicrobial effects. Trap analysis. Option A is incorrect because phenolics form a completely separate class of intermediate-level disinfectants known for leaving hazardous toxic residues, unlike halogens. Option B is incorrect because quats are low-level environmental disinfectants notorious for cotton depletion, not iodine-based formulations. Option D is incorrect because alcohols, such as 70% isopropyl, constitute a different chemical category characterized by their extremely rapid evaporation rates. Concept extension. While chlorine, another halogen, is highly corrosive to surgical instruments and restricted to floor spills, iodine-based halogens are formulated more gently to serve as effective antiseptics for living tissue. Question 11. What is the correct Spalding classification level for phenolic compounds when utilized within a healthcare facility's environmental sanitation protocols? A. Low-level to intermediate-level disinfectants. B. Intermediate-level to high-level disinfectants. C. High-level disinfectants, HLD. D. Liquid chemical sterilants, LCS. Correct answer A. Knowledge point explanation. Core rationale. Phenolic compounds are classified strictly as low-level to intermediate-level disinfectants. They are primarily utilized for decontaminating hard environmental surfaces, such as facility floors and stainless steel countertops, where the risk of transmitting infection is minimal. Trap analysis. Option B is incorrect because phenolics cannot achieve high-level disinfection status, as they cannot kill mycobacteria or viruses consistently enough for semi-critical items. Option C is incorrect because an HLD, like glutaraldehyde, is required for semi-critical instruments, whereas phenolics would leave a highly toxic residue on such devices. Option D is incorrect because phenolics lack the sporicidal properties required to act as a sterilant. Concept extension. Due to their potential to cause hyperbilirubinemia, phenolics are explicitly prohibited from being used to disinfect equipment in neonatal nurseries. Question 12. Which specific pairing of chemical agents is officially recognized and classified as high-level disinfectants, HLD, suitable for processing semi-critical medical devices? A. Glutaraldehyde and phenolics. B. Glutaraldehyde and orthothialdehyde, OPA. C. Quaternary ammonium compounds, quats, and phenolics. D. Halogens and orthothialdehyde, OPA. Correct answer B. Knowledge point explanation. Core rationale. Glutaraldehyde and orthothialdehyde, OPA, represent the two most prominent and widely accepted chemical agents categorized as high-level disinfectants. They are rigorously tested and approved for the chemical destruction of all vegetative microbes, mycobacteria, and viruses on semi-critical instruments like flexible endoscopes. Trap analysis. Option A is incorrect because phenolics are only intermediate-level disinfectants for floors, not an HLD. Option C is incorrect because both quats and phenolics are low to intermediate environmental disinfectants that cannot process semi-critical devices. Option D is incorrect because halogens, like chlorine bleach, are highly corrosive to medical instruments and are restricted to environmental blood spills, not instrument HLD. Concept extension. While both are HLDs, OPA has largely become the preferred alternative over glutaraldehyde in modern departments due to its significantly shorter manual contact time and drastically reduced toxic odor. Question 13. By definition, the process of thermal disinfection in mechanical processing equipment is fundamentally accomplished through the application of which mechanism? A. Heated chemical sterilants. B. Heated glutaraldehyde solutions. C. Prolonged high-pressure saturated steam. D. Sustained kinetic heat. Correct answer D. Knowledge point explanation. Core rationale. The precise definition of thermal disinfection dictates the utilization of sustained kinetic heat, overwhelmingly delivered in the form of highly heated water, to physically destroy and wash away pathogenic microorganisms, differentiating it completely from chemical-based processes. Trap analysis. Option A is incorrect because heating chemical sterilants changes the classification from thermal disinfection to a liquid chemical process. Option B is incorrect because heating glutaraldehyde is extremely hazardous, as it severely exacerbates the emission of toxic fumes into the worker's breathing zone. Option C is incorrect because prolonged high-pressure saturated steam defines terminal sterilization, which eliminates spores, whereas thermal disinfection does not. Concept extension. Mechanical washer disinfectors control this sustained heat using a precise metric known as the A0 value, which calculates the lethality of the thermal rinse based on time and water temperature. Question 14. In order to achieve a documented and acceptable level of intermediate-level disinfection, for what duration must a 70% isopropyl alcohol solution remain in continuous wet contact with the target item? A. 1 to 2 minutes. B. 2 to 3 minutes. C. 5 to 10 minutes. D. 10 to 20 minutes. Correct answer C. Knowledge point explanation. Core rationale. To successfully function as an intermediate-level disinfectant, clinical guidelines dictate that the treated surface must remain visibly wet with 70% isopropyl alcohol for a continuous contact time ranging from 5 to 10 minutes, allowing sufficient time to penetrate and destroy the microbial cell walls. Trap analysis. Options A and B are incorrect because a contact time of 1 to 3 minutes is chemically insufficient to reliably kill mycobacteria or stubborn vegetative bacteria. Option D is incorrect because requiring a 10 to 20 minute wet contact time would be physically impossible without constantly repouring the alcohol due to its incredibly rapid evaporation rate. Concept extension. Because alcohol evaporates so rapidly, it is fundamentally impractical for disinfecting large environmental surfaces, like operating room floors, and is restricted to small items like medication vials or stethoscopes. Question 15. Which of the following chemical solutions represents the optimal and most widely accepted choice for performing high-level disinfection, HLD, on heat-sensitive, semi-critical surgical instruments? A. Concentrated phenolics. B. Chlorine formulations. C. Iodophore complexes. D. Orthothialdehyde, OPA. Correct answer D. Knowledge point explanation. Core rationale. Orthothialdehyde, OPA, is an exceptionally effective choice for the high-level disinfection of semi-critical instruments, like flexible endoscopes. It boasts a rapid manual kill time, excellent material compatibility preventing instrument degradation, and is significantly less toxic to the respiratory systems of processing staff. Trap analysis. Option A is incorrect because phenolics are strictly low to intermediate disinfectants and are incapable of achieving HLD status. Option B is incorrect because chlorine formulations are highly corrosive halogens that will rapidly pit and destroy expensive metallic surgical instruments. Option C is incorrect because iodophores are primarily utilized as mild antiseptics for living skin prep, not as harsh instrument disinfectants. Concept extension. A critical protocol when using OPA is that the instruments must be thoroughly rinsed with copious amounts of water post-disinfection, as any residual OPA left on a patient contact item can cause severe chemical burns to mucous membranes.